Hi. All right, so we're going to do a Q&A. We're going to do a Q&A on the muscle, bone, joint, and inflammation section. And if you guys don't have questions, I guess I'll just randomly talk. But what questions do you have, or what have people been asking related to bone, joint, muscle?
I just want to know more about DMSO.
DMSO?
Yes.
Okay, DMSO is dimethyl sulfoxide. It's a product of the paper industry, sulf as in sulfur. And so I don't know what the exact property is. Maybe it's the sulfur, but it is an unbelievable pain reliever. No company that I know of is going to recommend you take it internally, although you can find a lot of information about people taking it internally for issues like cancer. And getting great benefit from that. Although we don't ever recommend it internally, it is an amazing topical painkiller. It's really strong. It's one of those things you don't let children get a hold of it and just drink the bottle, because that would be bad. But we used to carry it at the other place I used to work in Las Vegas. We'd actually carry it under the counter. But people can take it and apply it topically to severe pain, and it will take the pain away. I'll actually have people take DMSO sometimes and mix it with clay and make like a clay out of it for pain. You can also mix it with essential oils, so like a wintergreen or some other kind of pain relieving essential oil. So that's really all I know about DMSO. Now, if you read the label, it'll actually goes way beyond that. So it talks about healing sprains, swelling, that it works for cold sores and joint pain. It also says it helps dissolve scar tissue. I don't have any personal experience seeing it dissolve scar tissue, but that's what it says. Apply generously to knees, elbows, shoulders, bruises, swollen ankles, toe fungus, ingrown toenails, burns, infections, and any skin problem. And it says when applied minutes after an injury, it'll reduce healing time. Speed healing. Well, straight it would be. Yeah, if you drank it. So that's why people use it topically. And people do take it internally, diluted with water. I don't know any dosages for that. I just know that people do it. So I don't ever give people recommendations on taking it internally. Huh? Doesn't say. Nope. It says you can apply direct, and if it's too strong, you could always, of course, dilute it in water.
Is there any type of negative with it? Like if you start using that on a regular basis?
Not that I know of. I've never heard anybody say any negative. It just says it's a transporter. It goes immediately through the skin. It may cause temporary redness or burning. And so you might dilute it with a little bit of water if you needed to.
I should start pre-med.
Yep.
Do people put it on wounds?
You can put it on wounds.
Okay. Does it help speed up healing?
It helps speed healing. Yep.
Like open wounds?
Even on open wounds.
Okay.
Yep.
Super strong anti-inflammatory.
Yeah. It's sulfur based, and so I guess it's the sulfur. It's like MSM, which is sulfur. It's just a stronger version of sulfur. Yeah. Okay, so anything else about muscles, bones, and joints?
When do you usually recommend MSM?
When do I recommend MSM? MSM is known to be really good for bones, joints, muscles, muscle pain, pain relief. So people who have sore muscles and pain conditions and arthritis will tell you that they get relief from taking MSM. I've heard a lot of interesting stuff about allergies, about how taking MSM knocks out allergies. The other interesting thing about sulfur, it's one of the most important things for opening up detoxification of the liver. There's a whole book I read one time on liver cleansing, and it talked about how sulfur being one of the most important things for opening up liver detoxification. If you ever hear anybody talk about methylation, or that they can't methylate, which means they can't detox, sulfur is one of those main ingredients that is important for the body to properly methylate, or to open up the detoxification pathways of the body. B vitamins are important for that, but sulfur is also important for that. So a lot of people swear by sulfur being one of the most important things to help the liver detox. So pain, allergies, and just general like bones, joints, muscle building. Let's see what it says. So it supports healthy connective tissue like tendons, ligaments, and muscles. MSM makes the cell walls permeable, which allows water and nutrients to flow in and out of cells. So, you know, again, when you're talking about methylation, you're talking about detox at the cellular level. So clearly sulfur plays some important role in helping the cells to properly communicate and get nutrients in and toxins out.
And from what I remember you were saying to me once that how Dr. Wallace, the research has shown that we've been sulfur deficient in our soil
Yes.
since when, like the 19.
Yeah, Dr. Wallach, when he wrote his book, Dead Doctors Don't Lie, that, gosh, what's that book, in the 90s, I think? It was like 97 or something? It's like 20-year-old book. But he talked about how the sulfur was completely removed from the soil because we always used to, like, if you want to think of it in a funny way, think of like smelling sulfurous gas, like cow poop. Yeah, like farts and cow poop and eggs. So they used to use cow manure and animal excrement as fertilizer for farms, and they stopped doing that and they started using commercial fertilizers. And as soon as they started using commercial fertilizers, all of a sudden now the most important minerals and nutrients that the soil needs for healthy plants is missing, and one of those key elements that's missing now is sulfur. So almost no plants or fruits and vegetables that you buy anymore have good sulfur content, unless you're talking about like high sulfurous foods might still have some, like garlic and onions, which is one of the reasons garlic and onions are talked about so much for health and healing, because they do have a high sulfur content. But yeah, most of the soil is depleted of sulfur, and so that's the reason people will take MSM and benefit, because their body's missing sulfur. Just like with any mineral that's missing in the body, you put that in and it's missing, and things start to work better, cells start to work better. So
What do you recommend for a person who comes in with arthritis? What supplements would you like a combo?
yeah, so when people come in with arthritis, obviously there's always deeper reasons they have arthritis, but if you just want to relieve the pain,
Yeah.
I'll tell you what I gave to people for years was the joint astin. It has the astaxanthin with the glucosamine, flaxseed oil, boswellia. It's a very simple blend, soft gel, easy to take. This would clear up pain in people, and I used it for years. But now we all kind of default to the joint vibrance. Just because, I mean, you guys have heard the feedback. Like, everybody loves this stuff. We had a guy return one today because of some random reason, but most people we give this stuff and they just like love it. They swear by it. I mean, we've seen older people come in here that know nothing about nutrition, that come in like for the first time and they're desperate because their knees hurt or whatever, and they take this stuff and they're like, they're suddenly a believer in natural health because of this stuff.
Yeah.
So it's really just a nice blend because it's got the minerals in it, it's got the MSM in it, the sulfur, it's got boswellia, which might be the, next to turmeric and boswellia, probably the most commonly well-known herbs that are anti-inflammatory herbs. Bromelain, the enzymes reduce inflammation, and then it's got the cartilage builders. It's got the glucosamine, the chondroitin, the collagen, the things that build cartilage in the body. And it has silica and it has boron, and so yeah, it's just a really nice blend, the joint vibrance.
So if you're going to take one thing, that's probably it.
If you're going to take one thing, I would probably default to the joint vibrance as one thing. Yep.
And rebuild them.
Yes, it's going to reduce pain, reduce inflammation, and rebuild cartilage. We do have the collagen type 2 formula that's a straight collagen that will rebuild cartilage. When people got bone on bone, like this is a stronger way to rebuild that cartilage that's bone on bone. It's going to take 6 weeks to 3 months. You know, you're not going to take this and be like running marathons tomorrow, you know what I mean? But it takes time to rebuild collagen, to rebuild cartilage, but you certainly can do it. And so this is a cool product for that, the collagen type 2. And then a lot of people take the Great Lakes collagen, the powder, that you can just mix in water and drink it, or you can throw it in a soup and drink it. And people swear by this stuff for relieving joint pain and rebuilding bones and joints and rebuilding cartilage. The other thing that I'll just mention is the Bell shark cartilage. It's not as super popular today as it was 10 years ago, but when I worked at the health food store in Las Vegas, we couldn't keep this stuff in stock, the shark cartilage. Not only does it rebuild cartilage in the body, but something about it is like crazy, like anti-cancer. And so the shark cartilage was really big for cancer patients for a long time, back in like the late 90s. It was huge for that. And I think people still take it for that, but it's mainly recommended as a bone and joint product now. Also, a couple of decades ago, and again, I don't know how big it is now, but it was in every single personal care product. The shark cartilage was in all kinds of beauty products because of what it did for the skin and wrinkles and tightened and toned and all that kind of fun stuff. Problem is, a lot of people aren't a huge fan of it because you have to kill sharks to get it. So, that's the downside. But
Can you talk about Dodocin and try it?
Oh, Dodocin.
Dodocin?
Oh, are we really down to one? Did we order some of that? The Dodocin is actually designed by a medical MD in Columbia, Missouri, a couple hours from here. And Dodocin, do you guys remember, geometry? A 12-sided object. What's it called? Come on. A dodecagon. Dodecagon. Okay. So it's Dodocin, dode as in 12, as in like a dodecagon. So it's called that because there's 12 ingredients in it. And so it was kind of his version of the 12, all the things that people talk about that work for pain, that work for inflammation. He put the 12 most popular things that work in one formula. So it's MSM, glucosamine, turmeric, N-acetylcysteine, which is NAC, which is a precursor to glutathione, milk thistle, bromelain, boswellia, and inositol, which is a B vitamin. That's interesting. Trypsin, choline, and R-alpha lipoic acid. And people swear by this. We had that guy come in today, actually the guy that returned the joint vibrant stuff. He's like, yeah, I'm taking the Dodocin. That stuff's awesome. And Jen, when her back was hurt, she would take like 6 a day, and it would take the pain away from her back. Yeah, the other Jen. So, yeah, we hear over and over again the Dodocin works. The Dodocin works for pain, specifically for pain and inflammation. I'm not going to say this is going to rebuild cartilage and stuff. It might. I mean, it's got the glucosamine and some of the other things in it, but it's mainly a pain. The people that just want to get out of pain, I would default to the Dodocin. People who joint vibrance, again, it'll help get out of pain, but it also help rebuild bones, joints, ligaments, cartilage. But this probably isn't a strong.
More acute, good for an acute.
Yeah, Dodocin would be more for an acute, an immediate
Vibrance for long.
thing. Yep.
Or do both and then wean off the Dodocin.
Anything else for bone and joint and muscle?
I know you've recommended the collagen for, I think, digestive. Is that right or wrong?
The collagen?
Yeah.
Not. Yeah. Well, okay. Yes and no. So, one of the big components of the GAPS diet is bone broth,
Okay.
and so we actually just ordered the new bone broth powder. But it's like a bone broth, and you can just add water to it, and you got bone broth. And so all those nutrients that are in a bone broth soup, like chicken soup, people drink when they're sick,
Yeah.
it's very healing and nourishing to the intestinal tract, and it's loaded with minerals and nutrients and collagen. Skin is collagen. That's collagen. And so when you take a collagen supplement, it's going to heal bones, joints, ligaments, but it's also going to heal skin, and it's going to heal intestinal lining. It's going to heal the intestinal tract. So people will take this. I don't know about like digestion per se, but it's for leaky gut. It's for healing a damaged intestinal tract. It's for people who can't, whose gut's really damaged. Like there's some people, their guts are really damaged. They cannot eat raw foods. They can't eat fruits and vegetables. They're a wreck when they eat fruits and vegetables. Yeah. And so this kind of stuff, the broths, the more soothing stuff, steamed vegetables, the collagen, that's going to calm, relax, heal, soothe, provide nutrients that can rebuild that intestinal lining. And so this is the collagen, the powdered collagen is a way to do that.
Would you pair like stomach and bowel one with that or something?
Totally could. Yeah, that stomach and bowel one formula is awesome because So when you have a damaged gut, like you need mucilaginous herbs to soothe, coat, and heal the gut. And that Stomach and Bowel 1 formula by Dr. Morse is loaded with those herbs, plantain and slippery elm and marshmallow root and aloe vera. And I don't remember what was all in the formula, but those types of what are called mucilaginous herbs will soothe, coat, heal the intestinal tract. So ulcers, food sensitivities, over acid conditions, like people drink coffee and they're a wreck. You know, they eat acidic foods and they're all messed up. People have diarrhea. That formula is good for all that stuff, but it's going to heal the intestinal lining. And then you pair that with like chicken broth or like collagen or that new bone broth stuff we're going to get. You can start to heal that intestinal lining. And so what they have to do is stop eating foods that irritate the intestinal lining. So think about somebody with Crohn's, colitis, IBS. They can't eat raw vegetables. They can't eat nuts and seeds. They can't eat popcorn. You know, they can't eat foods that irritate the intestinal lining. Now, once that heals, ideally we get them to eating more raw foods and things like that, because that's ideal. But in the meantime, they can't, and they're not going to get better if they try to eat those foods. Now, they could juice fast, but not everybody's going to do that, and it's not easy to do. So
That's another path too, is just juice fast.
you can juice fast and heal your body and heal your intestinal lining, but you know, I really think providing some nutrition that will heal the gut lining is going to be more beneficial. Like taking the collagen or a bone broth or something, it's going to give you the minerals and the nutrients you need to heal the intestinal lining, where the juice is going to take stress off the organs and not damage digestion, but I don't think it has all the nutrients you need to actually rebuild your intestinal lining. It'll probably repair itself over time if you wanted to juice fast for 40 days or 3 months or, you know, whatever. It might eventually repair itself. But it doesn't actually provide all the nutrients that repair intestinal lining. And that's why people do GAPS diet and bone broth. And like one of the biggest, most popular things right now happening in cafes around the country is these bone broth cafes opening up all over the country because everybody's got damaged guts, you know? So, yeah, cool stuff. What else?
So post-surgeries, I remember there was someone here that, remember her son went to the emergency room.
Yes.
And then you gave her like Serratia.
I did.
What do you normally, maybe talk about
those products.
that product?
Sure. Serratia is an enzyme. It's serrapeptase. This Serratia is just a name brand. It's serrapeptase, which is an enzyme from a silkworm. And so it is it's a repair enzyme. So different enzymes do different things in the body, but one of the things serrapeptase does is it repairs damaged tissues. And so post-surgery, I give people serrapeptase. People sprain, strain an ankle, a ligament, something like that, you can give them serrapeptase. It'll heal it quicker. It'll heal up the scar tissue quicker. It says accelerated healing, fluid retention and swelling, that it helps with that, free joint mobility, and it even says post-surgical recovery. So it's well known for that. And then the other totally like random thing is it clears up the sinus cavity. So something about the enzymes in serrapeptase also eats mucus up out of the body. And I've had people with major sinus issues. There was a guy in Florida one time, he had this horrible sinus thing, this post-nasal drip. Of course, I gave him the Sinuorega, but I gave him the Serratia, and it just cleared all that stuff up. So it also works with chronic nasal issues as well. But great for post-surgery. So yeah, the joint vibrance along with the Serratia for post-surgery, awesome. And if there's actually a surgical scar, like there's a surgical incision, then get them that healing salve, that green salve that has the comfrey and the plantain and the olive oil, and it will heal up that wound, and it'll like blow your doctor's mind. Like my mom, you guys might have heard me say before, but she had double knee surgery, both her knees at the same time. And I told her to put that salve every day on that after the surgery. And her doctor said, I've done thousands of surgeries. I've never seen a wound heal so fast. Her doctor told her, her knee doctor told her that. And so that stuff is awesome for healing wounds, the healing salve.
Open wounds.
Not, well, yes, an open wound, but not bleeding wound.
Okay.
But once it's closed up and it starts the healing process, you know, you want to slather that stuff on there, man. It'll heal that thing right up. Yep.
What would you recommend for people who've gotten total knee replacement?
Well,
Like, just to live, like, I mean, you know what they do with that.
I don't know if I would give much recommendation for that. Just my mom had both her knees replaced, and she's great. She hasn't had any pain. She has no issues whatsoever. Some people do it, and like it's a total nightmare. Yeah, so it just kind of depends on how their body reacts to it, how good the surgeon is. If I was going to give them one thing, I'd probably resort back to the joint vibrance, just because it kind of does everything.
Just helps your body repair.
Yeah, it just helps it repair, because there's still going to be damage in there. So anything you can do to support the area is going to help. So.
What about the liquid silica?
Liquid silica?
What's that?
Yeah, liquid silica is bones, joints, hair, skin, nails. It's one of the main building blocks of tissue in the body. So the liquid silica, teaspoon a day, it's like a 3-month supply. Women take this mostly because after a month or two of taking this, they're like, nails are thicker, they're growing faster, their hair's thicker, all that fun stuff. So women really like this, but you can take it just for bone health. Yeah. Anything else?
Could you maybe talk a little bit about the FYI and then like some of the bone supplements, like maybe for broken bones, would it be kind of like similar?
Yeah, so for broken bones, a castor oil pack would be really good on a broken bone. Anything you can do to stimulate and bring blood flow to the area, because blood is what heals and repairs. Because remember, bone's living tissue, and there's blood vessels that flow through the bones. So anytime you can bring blood flow to the area, you're going to heal the broken bone faster. So anything to help with circulation and to bring blood flow. So a warm castor oil pack on a broken bone is awesome. The main herb that I know of for healing broken bones is comfrey root. Comfrey root is in that healing salve. The nickname for comfrey root is bone knit. There's another herb called bone set. But comfrey root, which is bone knit, is going to be in any good bone formula. You can look at different formulas. I haven't had a lot of people come in and be like, yeah, I got a broken bone, like what can I take for it? But I like the bone renewal and, you know, osteoporosis, osteopenia, what do I do to help with my bone health? You know, I am not a believer that you're just going to like take a bunch of calcium and all of a sudden you got healthy bones. Like that's some myth in the medical industry. It's the limited understanding that medical doctors have about nutrition. Like, hey, take some calcium, you got osteoporosis. Yeah, take calcium and get bone spurs and heel spurs and kidney stones. Yeah, it doesn't really work that way. You know, bone's living tissue, so you have to provide the body with all the things you need to create new bone. And what creates new bone that has been studied and researched, and what builds and creates new bones is really everything in this bone renewal formula. So it's got calcium, magnesium, everything's from a plant source. Vitamin K, very important for bone health. Silica, which we've talked about the silica. Phytase, strontium, which is a mineral. Boron, which is a mineral. Vanadium, which is a mineral. And then it has bamboo and a couple of other things. But mainly the calcium, magnesium, vitamin D, vitamin K, and minerals are the main things that you need to have healthy bones. And so I really like the bone renewal formula. I've given the bone and connective tissue formula to quite a few people. People, you can see in their eyes, actually, when they have weak connective tissues, and they kind of know it because they always getting sprains and strains, they're always getting hurt. Some people never seem to get hurt, some people seem to get hurt all the time, and so they have weak connective tissues. So you can take a formula like this just to strengthen the connective tissues. White oak bark is a common herb used to strengthen connective tissue. It's got alfalfa leaf juice, and the reason the alfalfa is because that's one of the most nutrient-dense greens on the planet. That's what horses eat, and they got big, strong muscles, the alfalfa. So it's got kelp, horsetail, which is high in silica. It's got dandelion. It's got deer antler. Deer antler is amazing for connective tissue and regenerating new nerve and new cell growth and muscle growth. And so this is a really good just overall supporting and healing like bones and connective tissue. The other formula you mentioned is the FYI. I don't know a lot about it. It's Garden of Life. I haven't sold it a lot. But it's good formula. It's got the chicken collagen in it, okay, which would be like the collagen. It's got chicken collagen in it. It's got ginger. So these are the anti-inflammatories: ginger, cat's claw, and turmeric. And then it has boswellia as well. It's got the algae in it, and it's got a lot of enzymes in it. So this is a tissue repair formula, kind of like the Serratia we were talking about, tissue repair. It'd be really cool if serrapeptase was in here, but I don't think it is. But it's got protease. Protease is a protein-eating enzyme. Scar tissue is made of proteins that like when you got a scar, that's proteolytic tissue. It's fibrin, which is a proteolytic. Am I explaining this right? Fibrinolytic tissue it's proteins, and when they build up in the body, and scar tissue builds up in the body, sometimes it builds up excessively, and people get scar tissue buildup. An example is a fibrin buildup is like fibromyalgia, where this fibrinolytic tissue builds up in the muscles. And so protease or proteolytic or protein-eating enzymes will break that down. I hope I explained that properly. So protease will help break down scar tissue and repair tissue. Bromelain, papain, amylase, lipase, and cellulase. So this is a called joint and tissue food. So it's FYI, it's a joint repair formula. And then the Grow Bone system by Garden of Life, they actually did some studies on this. They took people that had osteoporosis, osteopenia. They put them on this for, I don't remember what the study was, 6 months or 1 year or whatever, retested them and showed the increase in bone density. So proven to work through medical tests that it increases bone density. And that's the Grow Bone system. So it's all plant-based calcium. It's got the strontium, the vitamin C, vitamin D, vitamin K, calcium, magnesium, strontium, boron, silica, vanadium. Like it's kind of similar to everything that's in the bone renewal, because we know what the components are that we need to build and strengthen healthy bone. And so that's all in, this is like the Grow Bone system. And this is one package, a 30-day supply. So people will take this 3 to 6 months. And again, they can check before and after on bone tests and actually see that it works. And this, I don't know if they still do, but at one time they used to guarantee that it worked or they'd give people their money back. So, yeah, I don't know if they still do that, but yes. Did you have another question? No? Anything else?
So women struggling with osteoporosis, we could recommend any one of those bone formulas.
Osteoporosis by women, I would recommend, the Grow Bone or the Bone Renewal, but I would give them the Maca Pause if they're post-menopause. Yeah, if they're not not through menopause yet, then give them the Maca Harmony. But if they're post-menopause, one of the big issues with post-menopause is the estrogen imbalance issue causing bone loss. And so the Maca Pause actually helps balance that. And they've also studied and proven that their product increases bone density in post-menopausal women. Yep.
The Maca Pause?
The Maca Pause.
Wow.
Increases bone density in post-menopausal women. So if a woman comes in, she's post-menopause, she's like, I'm worried about my estrogen, I'm worried about bones, I'm worried about bone loss, I'm worried about osteoporosis, I would give them at least 2 things. I'd give them at least a good bone formula and the Maca Pause. And there'll be an improvement with that. Yeah?
Talking through the process of the body, and if the woman loses estrogen in menopause, what is the role of estrogen in keeping the bone density?
I don't know the mechanics of what estrogen does in creating bone density, but I know it's crucially important. And I know that there's a loss of it after menopause. And so that and so it affects bone health, but I don't know exactly why.
Related to the concept of like God's good designer. So women are estrogen, having estrogen, menopausal loss of estrogen, and obviously there's health things post menopause. So I'm just trying to think like God wouldn't design it if we get osteoporosis after menopause.
Oh, of course not.
So like what would be the normal route of the body? It wouldn't lose as much estrogen or?
I don't know, honey. You always ask the hardest questions. She always asks the questions I can't answer.
It might be because of the breakdown in nutrients, though, too. Maybe when we're eating plants and vegetables that weren't compromised.
Well, it's something to do with the hormones, so it's something to do with the estrogen, progesterone, and I don't know for sure. We could look it up because it is a good question. It might not be so much the estrogen, but it might be the progesterone. Because progesterone is what shuts off for the most part post-menopause. So it might be the lack of progesterone in the body and the estrogen dominance rearing its ugly head that is causing the bone problems or the bone loss.
Most women are so estrogen dominant that then go through menopause and they lose progesterone. It's like their estrogen is so out of control.
Yep.
I understand a lot. The estrogen is really acidic, and the progesterone helps to balance that. The acidity will
Ah.
pull calcium out to balance the acidity.
Okay, cool. So Mike said that he had heard or read that estrogen's acidic. There's no more progesterone to balance it. Now that estrogen is dominant, it's acidic into the bloodstream, and the body's pulling calcium out of the bone to compensate with the excessive amounts of acidic estrogen running through the body. So very well could be. So a woman might be able to women will take a progesterone cream even post-menopause to help with the hot flashes and the night sweats. They don't need the progesterone like for gestation because they're not going to have a baby, but they can use it for hot flashes, night sweats, and probably to ward off bone loss from synthetic estrogen. But you want to take the DIM product to remove the synthetic estrogen from the body, and probably liver cleanse. And really, that's the root of it. You know, let's just say this: if menopausal women had healthy livers, probably none of this would happen. It's really liver issues, probably more than anything, because if you don't have a healthy liver, you can't have clean blood.
Yeah. Well, that's kind of what I was alluding to, is that in the normal way, the postmenopausal wouldn't affect us so much, but because our bodies are so compromised from nutrition
Right.
in the first place, then it really affects us. Like
Totally.
you're saying, all the phytoestrogens and extra estrogen that we have
Yep.
probably makes the balance way more out of whack.
Yep. Yep.
God
Totally.
designed it to be.
Yep. Yep. Amen. All right. So should we move on to the digestive section?
Sure.
Any other bone, joint, muscle, tissue?
Just muscle pain, like people with low back pain. I mean, I'm guessing like DMSO or.
Okay. Muscle pain, and then there's nerve pain. And you don't always know the difference, and people who come in might not always know the difference. Now, if they have a nervous system disorder, like MS, Parkinson's, a lot of times heavy metal toxicity really attacks the nervous system, so there's nerve pain related to that. Muscle pain, a lot of times more muscle cramping. That's when we think of muscle pain. So really just minerals, relax that. DMSO would help with that if it's extreme. Magnesium oil just to relax the muscles. Castor oil packs is going to help both muscles and nerves, both of them. Castor oil is amazing for relaxing the nervous system. But if it's just muscle, it's mainly minerals. What makes muscles work is minerals. So a good electrolyte formula, magnesium foot baths, magnesium baths, any kind of minerals for muscle pain. And then if you're talking nerve pain, if you know it's nerve pain, then you're talking more like lecithin, B vitamins, nervine herbs, which like the chill formula or any herbs that relax the nervous system, which would be like hops, valerian, wild lettuce, even kava. Something else, the castor oil packs. All those things help with nerve pain and nerve-related issues. B vitamins is probably one of the most beneficial things people can take for nerve pain, if they know they have nerve pain. And that's same stuff. Yeah, if they have a pinched nerve, I would totally do the castor oil pack for sure. And I would do the DMSO because that's painful, big time.
Yeah, I had a pretty bad pinched nerve after I gave birth to and I lived on castor packs.
Yeah, we did do a lot of castor oil packs.
Well, I say I was doing chiropractic first, but when I introduced the castor oil packs, that's when I actually started.
Yeah, we were actually having her sleep in castor oil packs through the night. It really helped.
During the labor, somehow I got out of alignment and I pinched the nerve in my back.
All right, anything else?
What about for like a sciatic nerve issues?
Sciatic nerve, the same stuff, you could try it. Most of the time, I'm not going to say I know for sure, I'm not a chiropractor, but I would say most of the time with sciatic, there's something pinched. So it's chiropractic is probably what's going to help the most, a good chiropractor. And a lot of times it's a movement issue or a pinched issue. But I would totally try the joint vibrance and all the stuff we talked about for nerves. B vitamins, lecithin, minerals. But a lot of times with a pinched nerve, it's because there's a pinched disc or something that a chiropractor is going to be able to unlock that better.
Okay.
Or physical therapy, stuff. I'm sure Jen's worked with pinched nerves or sciatics, so I don't know. All right, cool. Let's move on to digestion.